Hello and welcome to another edition of For the Record. I'm Sean Murphy. My guest today has been on the show a couple of times before. He does public relations for Lawrence Memorial Hospital, L+M Hospital. Michael Farrell, welcome back to the show, my friend.
Thanks for having me again, Sean.
You know, one of these days we're going to hit the road and go down to your place for a change and just kind of see you in your natural states down there at the hospital.
Well, we'll do something a little bit more exciting than that.
Yeah.
My office in my state, as you were.
Not the most exciting thing.
Not the most exciting thing for the visual audience to see, but we could certainly arrange that when the time is right.
So, for those who may not have seen the other shows that you were on, sort of some background on what L+M is. Talk about it a little bit.
Well, L+M has been this area, southeastern Connecticut's community hospital, for now 101 years. We're located in downtown New London and have been providing care for this community and essentially the shoreline from about Old Lyme into Pawcatuck and now further, which we'll talk about in a bit, I'm sure. But the coastal community in Fishers Island, New York, even, and moving inward a little bit, Ledyard, Montville, and some of those communities. So for, like I said, 101 years, this has been the main healthcare resource for folks in this area.
And we will get to the acquisition of Westerly Hospital in a little while, the cancer center. But one of the things I remember us discussing last time was the way it's situated now, L+M can only expand so much on its main campus. So the logical thing to do would be to sort of set up these satellite locations.
Right.
It makes it more convenient for people in other communities close by, and it just seems like it makes sense, and it is the next logical step.
Well, you have to go back to the mid-'70s when Pequot opened in Groton, Pequot Emergency Room, and has other things there now as well. But that was a way to bridge the gap, if you will, from New London into Westerly and to serve that population on a more immediate basis for emergency care. And then it just starts to branch out a little bit. We've acquired different physician offices along the way, but also outpatient rehab is in Waterford. Our wound center is in Waterford. Our cancer center, soon to be in Waterford. We have an office in East Lyme. We have an office in Stonington. So we tend to go where the population needs us. And a lot of things are gearing in healthcare more towards the outpatient model and having these other facilities. So it's not necessarily an easy thing to get to L+M. I mean, you think it was built long before the highway, right. So you think today most hospitals would be right off the highway.
And this one certainly isn't.
This one isn't, and it's not the most convenient. So now, as we try to expand in different ways, we look for access points as the easiest way for folks to get to us. So that's where the focus is now. Our current campus is landlocked. There's nowhere to go but up, if you will. So that all has to be taken into consideration as our expansion needs have to be taken into consideration going forward.
Now, you're talking about not necessarily being right off the highway, and I think that one of the best moves L+M ever made was Pequot. Over the bridge, it's on the other side of the bridge, so if there's ever an issue with the bridge and you happen to be on that side, you're there, you're at Pequot. Hours are a little bit different. It literally is right off the highway, and it's just an amazing convenience, I think. And it really lets the load off of L+M, especially like maybe the emergency room and stuff like that.
Well, that's the primary focus of Pequot is the emergency care, but there are other services there as well. But from the emergency point of view, you're right, it's open from 7 until 11, so for the most part it's quite available for folks. And again, if you're on that side, you can save 10 or 15 minutes by going right there. It's fully set up. If there's a significant issue or if somebody needs to become an inpatient, they just get transported over. But when you combine the Pequot Emergency Room and the L+M Main Campus Emergency Room, we are the 5th most active emergency facility in the state. Now, there are approximately 30 Connecticut hospitals, and we are that high. We see that much volume. And there's a couple different reasons for that. Obviously, there's a significant population in New London, but also when you consider that the tourism crowd and the folks that spend their summers here, so there's more people in different times of the year that take advantage of Pequot. So that adds into it as well. But between the two places, the volume is extraordinary.
Yeah, and I think part of that, the reason for that is because don't you think that people in general sometimes, maybe because of just not having enough information at hand, but they have a tendency to visit the emergency room when sometimes it's not necessary.
Well, it's a huge factor in healthcare today. People don't have primary care physicians. So if you don't have a regular doctor that you see and you have an issue, you're going to the emergency room. And that's a big problem because a lot of times that's some of the root cause of delays in the emergency room is just the sheer volume. And the way that healthcare is changing, you need to find yourself a primary care doc. I mean, if you don't have one, now is the time to find one because that person becomes sort of your medical home and your place to go for all instances. Obviously, if there's an emergency, then you go to the ER right away. But what happens quite a bit is folks that don't have that primary doctor are using the emergency room as their primary care provider. And that puts a lot of strain on the system, and it makes for a lot of challenges.
And also, going to the emergency room, if you were paying out of pocket, it's more expensive than going to a primary care physician's office, right?
Sure it is. And for us, we take care of anybody who comes through the door,
right,
regardless of their ability to pay or not. And so there's a lot of challenges that relate to an emergency room. But the biggest message is if you don't have a primary care doctor, find one now.
Are you able to, or are you comfortable, being the PR person for a hospital like L+M, being able to talk about the state of healthcare in this country in general and the upcoming changes that could occur with things like Obamacare?
Well, I can tell you that it's not just in this country. It's in the state of Connecticut where it's changing because the recent budget that was passed by Governor Malloy and the legislature cut $550 million from Connecticut's hospitals over the next 3 years. L+M on its own is slated to lose $21 million in state aid. Now, that's got to come from somewhere. So that has the potential to be loss of services. It has the potential to be loss of jobs for people. It has the potential to make your emergency room time even longer, depending on the situation.
And people already complain about that in general.
Exactly. So that's just the state of Connecticut.
Yeah.
And there's a lot of debate back and forth in terms of the hospitals are receiving a windfall from the state. This is not true. We were losing, say, 30 cents on the dollar, and now are losing 40 cents on the dollar, and now we're losing 30 cents on the dollar in terms of some reimbursements. And the state looks at that as a windfall. It's not. We're also seeing more and more patients that don't have insurance. So those are other areas where we have to cover too. So Connecticut alone is having significant issues because of this budget that was recently passed. Moving forward on sort of a global basis, the whole system is changing. It used to be fee for service. You do a certain test or certain procedure, you got paid for it. That model is changing now. It's now based on results and experiences and that kind of thing. So we are constantly trying to reinvent ourselves, if you will, or trying to find ways to trying to find ways to save and trying to find ways to be more efficient, providing the best quality care at the lowest possible cost. And that's a big challenge. Healthcare is extremely regulated industry, which requires certain things to be in place in order to do that. When you're talking about reimbursements, you've got to make sure that everything is lined up and that we just hired a director of patient experience, because if you come in and you have a somewhat negative situation, that has the ability to impact us on how much money we get down the road. So we're looking all throughout the system of how do we provide the best care and the best experience at the lowest possible cost.
Well, your goal would be to make sure that person does not have a bad experience, so that you want to avoid that.
Exactly. We want to make sure that you come in and your medical needs are taken care of, and that you're treated well and you're respected, and that you have a good experience while you're there. If we do both of those things, then that helps going forward. But yeah, the entire model is changing. There's a lot of questions about Obamacare coming in, and we're going to see a sort of a constant flux and transition and questions over the next couple of years. And so, yeah, stay tuned, because it's changing rapidly.
Yeah, and it's the outcome is to be determined. There really
right.
isn't.
I mean, some people have a theory as to what's going to come out, but until it completely gets there, no. But the change has started, and that's why we're constantly trying to evolve and constantly trying to find ways to make ourselves stronger, leaner, and more efficient. and what's happening in the state of Connecticut isn't helping, but we're doing our best.
When it comes to, like, for example, Obamacare, considering that it is designed to make sure that as many people as possible are covered with some type of insurance, from a hospital's perspective, from L&M's perspective, wouldn't that be a good thing to have as many people as possible actually be covered under some health insurance?
It would be a good thing if the system actually gets up and is running. Right now, your guess is as good as mine. But yeah, that's not necessarily a bad thing, because like I said, now we have folks coming through that don't have ability to pay one way or another, and we absorb that, and other hospitals like us do. So in that sense, yeah, it's a good thing. But until things can be laid out and how that actually happens and how that goes into place, that's where the questions are now.
When you get somebody who gets concerned about healthcare costs in general, sometimes people mention doctors and by association hospitals, and then sometimes they talk about the insurance companies. How palpable are the insurance companies in what we have now?
Well, in terms of what we have now, I mean, there are different payers have different standards. So there's nothing is necessarily consistent across the board. So we have folks that live and breathe this stuff every day, and so they know. But from the general public's point of view, what they should know is that at our place they're going to get care. Obviously, if they're covered, that's a better situation. But yeah, this is a big situation that's not going away. There's going to be a lot of questions. There's a lot of uncertainty now in terms of how it's going to get rolled out.
And big changes right over that
it's
horizon.
There. It's already started. There are things, sort of back office things that have started, but it's coming. Yeah. It's definitely coming.
Most people aren't aware that L&M, and I guess like most hospitals, is a nonprofit. Talk about that a little bit.
Well, again, it speaks to the mission, and it speaks to providing the community with care. And from our perspective, it means that anybody and everybody gets treated. What it means in terms of the business is that the money that we do make, because nonprofit doesn't mean zero margin.
Right.
Our goal every year is to have a 3% margin. And if we succeed in that, that's the money that gets reinvested into the facility, so you have the best technology and the best equipment and the best people to treat you when you do come in. So yes, we try to find a positive number, if you will, a profit, but it gets turned right back into the organization. So when there's a new diagnostic imaging machine or some new surgical instruments or something that we need to provide the best care, that's what that money gets used for.
Well, since you're talking about expansion and new things that you can use with that, hopefully that 3%, let's talk about some of the things. Let's talk about the cancer center.
New cancer center opens this October. Now, we have community cancer care at our hospital now. It's been in existence for quite some time, but we have formed a very exciting and what we think to be excellent affiliation with Dana-Farber Community Cancer Care out of Boston. Obviously, Dana-Farber is one of the leaders in the world in cancer care. We are the first Connecticut hospital to be affiliated with them, and we're building a new facility just off 95 in Waterford that's going to open in October. So what this will do is provide our cancer patients with essentially one place to go for doctor's visits, for treatment, for visits with a dietitian and a social worker and patient navigators and all these types of things. The tie-in with Dana-Farber brings an extended essence of clinical excellence. Number one, it brings access to clinical trials. It brings access to second opinion clinics and genetic testing. So there's a lot more stuff that becomes available. A lot of people don't realize that this part of Connecticut has the highest rate of cancer in the state. And so it's not going away. And what this does is it just provides the best space and the best clinical partnership that we can provide to the residents in this area, so that if they do have that diagnosis and if they're currently going to New Haven or if they're currently going to Boston or to New York, that they can stay close to home. So this is one of the biggest things that L+M has done in its history, quite frankly.
Speaking of Boston and being able to stay close to home, the Joslin Center, you deal with diabetes, and would the next closest place be Boston for that?
Well, Joslin, you're right. We have an affiliate with Joslin, and I'm not sure where their other affiliates affiliates are located. But for us, what it speaks to is trying to align ourselves with these clinical partners that provide the expertise, the Jocelyn's and the Dana-Farbers, and being connected that way, so the patients that are dealing with diabetes or cancer don't have to travel, and they've got the best care that they need right here.
All right, we've talked a lot about Connecticut, so let's move to Rhode Island, because that was one of the biggest reasons I wanted to have you on the show today, was to talk about the acquisition of Westerly Hospital.
Sure.
So wherever you want to start with that.
Well, Westerly Hospital has been an excellent community hospital for quite some period. I was born there. It speaks to the goodness of it right there.
Really? Well, it can't be perfect at everyone.
Right. So, Westerly and L+M are about 20 miles apart. So, in essence, there's been some sort of overlap of market, if you will. And I think in this area in general, Sean, we're very fortunate in terms of how close we are to a number of
Right.
really good hospitals. So, folks in South County have had the opportunity to go to Westerly for some time, and the good news now is they still will have that opportunity. Westerly had some financial challenges, if you will, and back in December of 11, they filed for receivership, which is essentially a type of bankruptcy, if you will, court-protected receivership. And prior to that, we were in talks to have some sort of merger going on with them, and when they filed for receivership, all of that stopped, and the process became one of a acquisition. So L+M was interested in continuing that. We were declared the stalking horse bidder, which means all other bids had to be compared to ours. So we put out what we thought to be a very favorable and very strong offer.
Other bids from other
institutions would be lined up against ours. So we thought our offer was strong out of the gate, and it was approved by the court, and then there was a long process of due diligence and a lot of legal things to get straightened away. But the most important thing is that we have made a 5-year commitment that's part of the deal, that we will continue Westerly Hospital as it is, that folks will continue to be able to go up to Wells Street, and their community hospital will be there. And that was probably the most important thing for the community. And this process got very strong engagement from the community. There was a group called the Westerly Hospital Area Residents Committee that was acknowledged by the court as a part of this procedure, and they were involved in a number of different things, and we met with them a variety of times to explain to them our ideas, to hear their feedback.
Were they just expressing concern?
They wanted to make sure that their hospital was going to exist,
yeah.
right? Because there were a couple options at play here. Somebody like a nonprofit like L+M could come in and could take over the hospital and run it the way it is, or there was always the strong possibility that an outside for-profit company could come in, strip it down, make changes, and sell it off. Mm-hmm. And L+M has been strong and independent for more than 100 years. Westerly has been strong and independent for a number of years, and we wanted to make sure that independence was still going to be there. So essentially, the acquisition was made by what's called L+M Healthcare, which is the parent organization of L+M Hospital, of Westerly Hospital, and of a couple other entities along the way.
And if you look at L+M's track record recently with their desire to expand, satellite-wise, you could kind of look at this, probably the biggest one, just because of the size of Westerly Hospital in and of itself already, but just, just adding to it another satellite, except it's its own hospital. But,
it's its own. I understand your point, but it is important to know that it is an independent hospital. The staffs, with the exception of the leadership, the staffs are distinct, the medical staffs are distinct, and the care is distinct. I mean, it's the same quality just in either place, but Westerly Hospital is one entity, L+M Hospital is another entity, owned by the same parent organization. But the most important thing is that the hospital there exists. It will continue to exist. There were a lot of rumors in terms of, L+M is going to turn it into a Pequot. Well, there'd be no reason for us to do that.
Right.
So this is a huge benefit for the community. It certainly strengthens L+M, but it also strengthens instance, Westerly. We know that that hospital can be successful. It has been. We know that the patients are there. They need to come back. You know, there was 18 months of uncertainty, and there was concern in that community, and now that things are stable and things are moving forward, we expect that, you know, folks will continue to use that as their community hospital and will continue to thrive. They get great scores on patient satisfaction. There's a fabulous medical staff there. So the changes that are happening are in the business model more than anything else. It's in the billing and that sort of thing that we've sort of centralized and really turned our folks who are quite strong at this into making Westerly profitable again.
But one question on that, does it create any redundancies where there might be some, you know, jobs that have to be kind of moved or switched or maybe even eliminated when one entity acquires another?
Well, there were certainly some changes when it happened, and most of it was at the management level, as most people I don't think were surprised at. There were some other positions along the way. I mean, that was one of the difficult parts of it.
And that happens when you're talking about any kind of a merger or acquisition.
That happens,
yeah.
And you know, we don't make light of it at all, and there were difficult times, and the staff at Westerly are to be commended for the way that they maintained all the way through this. They gave back in certain cases, and they understood what was happening, and no matter what, the focus was to make sure that at the end of the day, the hospital was going to be there and was going to continue to be strong. And there is, as I said, the business office is now centralized. You know, the stock room, if you will, is now centralized. So those are key things when you talk about supplies. Now, instead of ordering for one hospital, we're ordering for two. There's more savings involved.
Right.
The distribution point changes. But, you know, other than that, if you're in the operating room at Westerly and you need supply X, you call up the phone just as you have, and supply X arrives.
Yeah, you know, I was going to ask, you know, does this create more resources for Westerly Hospital now that they're kind of part of a bigger network? I mean, do our patients, do they have availability that they didn't have before?
Well, what happened? The first thing is there's really no difference for the patient. They're going to continue, with one exception, they're going to continue to get the care that they're used to. But again, when you tie into things like the cancer center, you know,
Right.
if you were in Westerly before, where are you going to go? Now you might come over to L+M. The big difference that has been talked about quite a bit is the one service that was stopped was OB and the delivery of babies at Westerly, and that was really a numbers situation. You know, Westerly was not delivering a sustainable number, if you will. I mean, less than one a day, whereas L+M, you know, we deliver about 120, 130 babies a month. So what happens?
That's a big difference.
It's a big difference, and what happens now is if you're you know, expecting in Westerly, and you have choices, and obviously one of them is to come to New London, and
it's not that long of a drive.
It's not
either.
that long of a
No.
drive, but I tell you, there's always this big thing about, well, you've got to go over a bridge, and
Well, that's why you put Pequot in place for one thing, you know.
You know, the fact is that we're 20 miles apart, and sure, that may seem it when you're talking about, you know, such an important situation like that, but it's really not. The other benefit here, and it, I think, provides some area of comfort, is L+M has a NICU, a neonatal intensive care unit. So if there is a challenge with a birth, the baby receives the best possible care immediately. So that, I think, is somewhat of a comfort to the folks in the Westerly Pawcatuck area that were maybe, you know, hoping to deliver at Westerly. But that's really the only change.
But the grand scheme of things is they get a hospital that's stable financially and in their community still because of this acquisition.
Absolutely. And what we are committed to over the initial 5-year period is to maintain the services that are there and to reinvest in that hospital, to pump $30 million in for infrastructure changes, technology, and facilities, to make sure. We didn't take this on just to keep it the way it is. We took this on to bring it back to what we know it can be. And we know there are technology upgrades that need to happen, there are facility upgrades that need to happen.
Is Westerly High School hospital landlocked the way L+M is, or is there a little bit of expansion room there?
Well, I mean, we're a long way from looking at that.
we're just
but,
acquiring it.
You know,
right?
there are a number of buildings that are around it that the hospital owns, and that whole area of Wells Street has a number of physician offices around it. I mean, there may be some room there. I mean, I'm not going to be the expert on that, but we're a ways away from having that conversation. I'll be back on the show though
to
when
talk
we're ready
about the
to
next
do
one.
that.
I think one of the last times you were on the show was that we were celebrating. Was it 100 years or
100
something?
years.
Like that?
Last year was L+M's 100th anniversary. We just had our big fundraising gala celebrating year 101. We are just getting ready to launch the public phase of our capital campaign to raise money for the Cancer Center, which is a price tag of about $35 million. We're more than halfway there through the private phase, and now we'll be looking for public support to sort of get over the hump there. But, you know, people should be confident, whether they're in the Westerly Hospital area or the L+M Hospital area, that both of these hospitals are strong. They're getting stronger. Westerly is going to rebound just fine. There are excellent medical staffs on either side of the river, and that the quality of care that they expect is continuing.
What about you personally? I remember a while back, because we go way back to your former days at the Seaport, and you were telling me that you were kind of learning the lingo a little bit more as time went on at your position at L+M. So you're learning all the fancy terminology and everything.
I could throw a bunch of acronyms your way if that's really what's going to impress you.
I'll believe anything.
That's
really,
right.
So.
Well, you know, look, healthcare is a challenging environment for everybody. I mean, I've got 2.5 years of experience. Do I know more than when I first started? Sure, but I got a long way to go.
Right.
You know, I'm not going to be in the operating room tomorrow, at least not performing one. So, you know, there's a lot to learn, but, you know, I've got my resources.
But with everything that's going on with L+M, you've got a lot to talk about, and you know, in your position in public relations, I mean, that's just nonstop.
It is nonstop, and that's a good thing. I mean, right now there is a lot of good that's being talked about. There's a lot of good that's happening, but you know, this is an industry that is evolving like crazy. This is an industry that people have incredible passion about. So if there is, God forbid, any type of negative situation, it tends to get I won't say exaggerated, but it tends to get talked about quite a bit, and because there's so much passion involved that everybody wants the best for themselves or for a member of their family, and so a lot of times it's just explaining what a situation may have been, or explaining the best way to go about a certain thing.
We are out of time, unfortunately.
Already?
Yeah. Website for L+M.
L+M Hospital, lmhospital.org.
You wanted to give the Westerly site out too?
westerlyhospital.org.
Public relations extraordinaire, Michael Farrell for L+M Hospital. As always, pleasure having you on the show.
Good to be back. Look forward to the next time.
And thank you for joining us for another edition of For the Record. You can see this show and many others on our YouTube site. In the meantime, I'm Sean Murphy. We will see you next time. Take care.